Welcome, everybody. It's the Radio Surgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. Hope you're all doing great and had a great week. This is our first of 5 shows this weekend, and we're taking your calls. We're live, and we've got lots of news and lots of patients and lots of information to provide to you. I welcome many physicians who've called me in the last week who listened to this show. So I appreciate your kind words and support and invite you into our office to tour our place if you'd like to see Radio Surgery New York. I'd like to start out with the good news department, and we have a lot of good news. I've been in practice for 25 years in New York, and we had a woman who came in that I treated 15 years ago for a brain tumor. So often people think, wow, brain tumor, that's the end. Well, this woman came in from New Jersey. She's now 74 years old. She came in with her husband. We treated her 15 years ago for a CP angle tumor, a tumor at the cerebropontine angle. It was a large tumor. Yeah, she could have had surgery, but she probably would have been left deformed with facial paralysis and loss of hearing. Her tumor has been controlled over all these years. She's remained intact. She came in for a 15-year follow-up, so that by itself is great news. Neurologically, she's in great shape. I examined her. We got her images. We got her CDs, and we're having a second opinion on the CDs, so people feel comfortable that it's not only one doctor, their doctor, who's reading the scans, but independent group of doctors, and we've got that back showing the tumor is controlled. So it tells you a lot about our work. We were the first ones in New York to perform fractionated stereotactic brain radiosurgery. That means for brain tumors, benign or cancerous tumors. We can hit the cancer or the benign tumor. And in the brain, we treat many, many benign tumors like acoustic neuromas, meningiomas, pituitary tumors, and other tumors. For meningiomas, our success rate, where we attack the tumor, we can stop it, and our data shows now 97% control rate. We've been at this for more than 2 decades, so it tells you a lot about the success and the beauty of non-invasive treatment. So I think most people would prefer that no one's hands go in their head, even if they have a brain tumor. And it's always worth getting a second opinion, and we encourage you all, if you know someone, to think about a second opinion. This is the good news department, and we've got much more good news. We have another man in the same good news department. A gentleman came from the tip of Long Island. Now, his son heard about 3 of my patients, and they all had great results. The man's father, who carries his same name, interestingly enough, developed abdominal pain and shoulder pain and was found to have a cancer in his liver. So cancers in the liver are notoriously difficult, right? And he had a cholangiocarcinoma in the liver. He came to us. We got a PET scan. We staged him up, like I talk so frequently of staging the patient so we know exactly where the cancer is. Luckily for him, it was localized to one spot in the ducts of the bile system where the liver drains into the intestines. It's called a cholangiocarcinoma. He was treated with radiosurgery. He now comes for his 3-month follow-up. Now, before, the PET scan showed the mass, and it showed that it picked up the radioactive sugar, the PET scan part. Remember, PET CT scans have 2 parts. One that showed the image of the cancer, and the second that shows the activity of the cancer. Well, his follow-up showed that the activity of the cancer totally went away. That's right. After radiosurgery, the activity of this cholangiocarcinoma totally went away. Good news number one. Good news number two, and there's no cancer anywhere else. So he's in remission. He's had the focused treatment. All of it is non-invasive, no cutting, no bleeding. Treatments with us take 15 minutes. Now you could say, well, why would he come from the tip of Long Island to us for a 15-minute treatment? Well, ask him and ask his son, and they're pretty happy. They're happy because we have a large experience over decades treating thousands of patients, actually about 20,000 patients. And to help your life, it's surely worth it. So a lot of good news department today, thank God. Again, if you have questions, you're welcome to call us at 212-246-4237 or 212-CHOICES. That's 212-246-4237. So I want to talk about another man, a man who's 84-year-old, black man, widowed with 2 kids, came in. He was diagnosed with prostate cancer late. Now, a lot of men think, oh, no one gets hurt from prostate cancer. You can live with it. You can live without it. Doesn't matter. Don't get treated. Well, this man didn't get early diagnosis. And he was diagnosed in 2012 with metastatic prostate cancer. So that means the cancer had already traveled. It left the prostate. It got into the bones. His PSA was very high. Now he started on hormonal therapy, and now the hormones are no longer working. He has pain. He came to us. So again, we're staging him up. He hasn't had PSA, that cancer marker for prostate cancer, prostatic specific antigen, in several months. So we're getting a new PSA. We're staging him up with a CAT scan and a bone scan to find out exactly where the cancer is. We know most probably we can take care of his pain. Where we attack the prostate cancer, whether it's in the prostate or beyond, our success rate is very high. And for most cancers, we can stop the pain and suffering. So we're very hopeful for this gentleman that we can stop the pain and suffering, we can find the cancer, and we can offer him different treatment even when the usual treatment doesn't work very well. So the message here is, for all men, sometimes, you're diagnosed with prostate cancer, you're feeling great, you have no symptoms, you say, wow, this is not so bad. The problem is not today. The problem is tomorrow. And most men, most women, most everybody want to live, want to be cancer-free, want to be pain-free. And sometimes it's a little bit like Aesop's fables. You have to work all summer to save those nuts so you can live comfortably all winter. And if you play all summer, as Aesop said, then you'll probably dance all winter, which means you'll probably be jumping up and down to stay warm. The same is true with cancer. If you don't take care of the problem today, it most likely will grow to a bigger problem tomorrow. So the message is, this man, 84, still wants to live. He wants to be pain-free. We're going to work with him to get him pain-free, take care of the cancer, and hopefully get him into remission. If you have questions, by the way, we have a new prostate cancer booklet. Just came out last week, and we're happy to send it to you. It shows our data and comparison data with other major centers across the country. You can call our office during the business hours, Monday through Friday, 9 to 5, and we'll put a package and a DVD in the mail to you at no charge. We have another patient I want to talk about today, and that's a woman who came 48 years old with cervix cancer. Now, what's the number one lesson about cervix cancer? Well, there's a vaccine that's available. Most cervix cancer is caused by human papilloma virus, so cervix cancer is often a sexually transmitted disease-related cancer. If you can stop that human papilloma virus, you most likely can stop the cancer. So there's been a big political brouhaha about vaccinating children, boys and girls. Boys can carry the virus as well as girls. The purpose of the vaccine is to try to avoid cancer in the future. Well, this woman, 48 years old, never had the vaccine. A year ago, she was diagnosed with the human papilloma virus, so she had been infected. And this year, she has invasive cervix cancer. So for early cervix cancer, there's basically two kinds of treatment: radical surgery or radiation. She's come to us, and she's going to be staged. So we're going to find out exactly where the cancer is to determine whether it's an early or late cancer. And with us, the staging was done immediately, within 24 hours. She just came to us yesterday, so she will have her answer on Monday. And then we will talk about the staging, the prognosis, and the treatment. Radiation therapy is highly effective for cervix cancer. So the success rate for stage 1 cervix cancer is approximately 90% without losing the uterus. So it's outpatient therapy, well tolerated. Again, for women listening and their husbands and their loved ones, there's a vaccine available, which you should speak to your physicians about, especially for you and your children. Women should get pap smears. Pap smears have related to a marked decrease in the rate of invasive cervix cancer and the death from this disease. We're going to hear from our sponsor now, and we'll be back in just a moment to take your calls. Again, we're at 212-CHOICES, 212-246-4237. We're going to listen to our sponsor and new voices, and then we'll be right back to talk more about cases and information that may be useful for you.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radio Surgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radio Surgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're taking your calls. We have new information. And I want to talk just a few moments about mammography.